Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Angie Walker, and she's the Office Administrator of Walker Family Practice Clinics. Angie, thanks for being here today.
Thanks for inviting me.
So we're talking about rural healthcare and your practice. And can you start by telling us about your clinic in DeQueen and the population that you serve in Sevier County?
Certainly. So we basically have 4 locations. I'll start with the main location. So we have 4 locations. We have 9 nurse practitioners and 2 medical doctors. And so for the main clinic here in DeQueen, the biggest location, we're open Monday through Sunday, 7 a.m. to 7 p.m. with after hours triage. And then we also have a home-based schedule and a nursing home schedule for this clinic. We have a pediatric clinic still in DeQueen. It's Monday through Friday, 8 to 5. Certified pediatric nurse practitioner who's fantastic. We also have a school-based clinic, Leopard Care Clinic. It's Monday through Friday, 7 to 4. This year is actually the first year that we made it year-round, and so we're super pumped about that. But it also manages our school-based clinic and then also handles all of our chronic care management and also some home-based patients too. And then we have another satellite clinic in Derricks, Arkansas, and it's open Monday through Friday, 8 to 5.
And what specific health challenges or needs does your community face, and how has your clinic adapted to meet them?
I would say we face the same as all other rural clinics, and I'm sure even some urban clinics as well. So for us, our city population boasts 6,000 with a county population of 17, which is absolutely wrong. Our city population is probably closer to, I would say, 10 to 12,000, and our county population is probably closer to 25,000. We are probably 65% Hispanic, I would say, at least, just based on some demographics at school. And we also have a Marshallese population of about 300. So we battle housing issues, lack of housing issues. We battle transportation. We've also got a poverty level that's kind of up there, and then also some food insecurities too.
Your clinic has made notable success with immunizations. What has been the driving force behind that?
So I think for us, it's probably been the partnership with the school. Just some of the things that those school nurses have to deal with on a day-to-day basis, that's tough. Once we started kind of integrating in and learning everything that they were managing on a daily basis, it was insane to me. And so, of course, when COVID hit and everything shut down, we had AAFP screaming, you've got to keep everybody immunized and what have you. And so I think that jumped us off in there along with the school. And so we just kind of have this motto, we're checking everybody and we're doing it right now. If we got to meet you at Walmart, we're coming to Walmart. We also partner with one of our local restaurants here. And so on the kids side, if they come in and get their shots, then they get a free mini pizza. Same thing at any of our clinics if they do that. And so I think it's just one of those things that we decided it was going to be a quality improvement project, mostly for the school nurses, but it kind of just exploded and just went clinic wide.
And you touch a little bit about outreach. And what kinds of outreach, aside from meeting them where they are, is there reminder systems that have worked best in your area to improve those immunization rates too?
So we do, of course, we send out reminders in eClinical Works. We make it a point to be on site for every school registration. Every school registration that we are either inside that county or inside that district, or we're touching that district. So we will be on site at Cossatot when they do kindergarten roundup and catch everybody up. We go to Horatio. We're at every registration for the DeQueen School District, and that's primary, elementary, high school, middle school. We just try to make sure that we're there and we're showing up at everything that we can show up at. And that's the first thing that we're taking, especially if we're doing smaller kids. We want to make sure they're kindergarten ready. We're doing their vision and their hearing, and we're trying to identify those problems early so that we can catch them and get them resolved.
And do you work with, aside from schools, as churches, employers? Are they involved in some of this as well?
We do. So we currently partner with Pilgrim's Pride here, which is our biggest employer at about 1,500. And so we have a nurse on site there 1 to 2 days a week. And so come cold and flu season, we're going to be on site doing flu shots. We also partner with our college. CCCUA has campuses here, Nashville and Ashdown. We're going to do the same thing. As soon as cold and flu hits, we're going to be at every campus offering flu and pneumonia shots. Same thing if they've got nurses or students or what have you that are behind on immunizations, then we're bringing those with us as well. And pretty much just any churches, the same thing. We're getting ready to kick off a huge children's health fair. We'll see about probably 400 to 500 kids. It's actually going to be this year. DeQueen Church of Christ has given us space. And so we'll be there doing immunizations, haircuts, vision screenings, hearing screenings, with the big goal being everybody's ready for school. And again, our ultimate goal is to reduce that workload off of that school nurse. There's other things that they can be looking at versus chasing kids for immunizations.
And Sevier County has seen a very low measles outbreak compared to other parts of the country. I mean, much of this push for vaccinations has contributed to that success.
I would say we stay at about 98% within the school district, or in even our whole clinic as far as keeping kids immunized. And so, and I'm talking about those tried and true immunizations, the ones that we know that have been around that are required by the state. And so we try to, it's a quality improvement project for us. And so it's just one of those things that's just always in the forefront of our mind, making sure the kids are ready, prepared, and vaccinated.
Are you seeing vaccine hesitancy locally, and how have you effectively addressed that?
I think anytime you come into a rural area, you are always going to have that hesitancy. And again, that's okay. This is America. You get to choose what you want to do. And so for us, it's just an educational thing. And so we try to make sure that we're providing all up-to-date information. We're very honest about if we don't know, we don't know. And so I think we just, most of these folks are our neighbors. We go to church with them. We grocery shop with them. And so I think just making sure they understand where we're at, what we agree with, what we think that is appropriate, or what we know information about, we're going to share that information. And then we're certainly going to respect anybody that has a difference of opinion. And then for us, what we've seen, used to it was HPV. No one really wanted to deal with HPV. And so we did a pretty big push on screening for different kinds of things. And I think that was a real eye opener for us, again, in a rural area. And so I think once we were able to jump in and do some of that education, I think we've even seen those numbers increase. So I think it's all about education and then meeting that patient where they're at. Mm-hmm. And if they're hesitant, that's okay. We'll continue to have that conversation until we resolve that. And that resolve is I'm not going to do it, or we've provided you with enough education so that you can make a good decision.
And what specific team workflows, protocols, and even quality improvement practices have made a measurable difference in your clinic's outcomes?
So for us, anytime we're seeing somebody under the age of 18, we're pulling WebIZ immediately. We're looking at, do you have everything that you need? Is everything covered? Same thing, anytime they're coming in for a wellness visit, we're immediately pulling that WebIZ and making sure that we've got that information. We're kind of a little bit on the border. A lot of our folks are Oklahoma and back, or they're Texarkana and back. Mm-hmm. And so we spend a lot of time cleaning up immunization records as well, because we don't chat with each other. And so, for us, it's a priority. And so it took a whole nother level, a whole nother stance once we brought in the pediatric clinic. We've had the pediatric clinic for about 2 years. And so I think that was a very big educational thing for Nick. It was very important to him. And so again, you're leading by example. You're showing folks, and you're educating, and you're providing information. And so, other than it's just constantly on our mind and we're constantly trying to figure out how to improve it, I don't know.
Well, measures are noticed for sure. And taking that a step further, how do you train and support your staff to maintain high standards in preventive care?
So for us, we sit down once a year and look at all of our metrics. We follow probably about 30 metrics in the clinic that are spent are split amongst different departments. So the front desk has a metric set, lab and allergy has a metric set, the nurses have a metric set, and even my providers do, and they cross-reference. So there's not just one department working on anything. And so we pull those metrics on a monthly basis. At the beginning of the year, we set them, we identify them, we agree on them. We set our benchmark for July, and then we set our final benchmark for December. And so, and we've got to meet those. If we don't, because we bonus twice a year, we bonus in July and we bonus again in December. And so if we're not meeting those benchmarks, it hurts. It doesn't just hurt the provider, it hurts all the way through the staff. And so I think that has really helped us as far as keeping an eye on things. And because as myself, I can't manage 30 metrics through 75 employees in 4 different locations. They have to have that buy-in. And so I think just us sitting down, meeting, talking about them, and then agreeing on what those look like is huge. Like we had our meeting this morning about July or June. We cut it off June 30th. And so we've hit some and we've hit them really good. And so I told the group, I said, well, I'm actually going to move the December metric because you're exceeding it by 7 to 8 points. It seems crazy to leave it that low if we're already exceeding it. Mm-hmm. They weren't real happy about that, but they did understand, that constant need for that upward trajectory. So,
well, have you implemented any technology or data tools that have helped your clinic stay on top of immunizations?
So for us, we have a bi-directional with WebIZ. And that's for all the providers, all locations. So the minute we give an immunization, it's immediate. It's immediate into the system. I would say the same thing for us when we are on site for registrations. Used to, you did not take technology with you. You didn't take it out of your office. Now that's more mobile for us. If we're going to be on site, we want to be looking at that mom right then and there and saying, oh, so-and-so is missing this, this, and this, and we've got it. We can do it right now. And I think, again, you're meeting the patient where they're at. You're not requiring them to take additional time, take time off work or any of that. And I think that helps. And I think the same thing on the clinic side, once we went to 7 days a week with a 12-hour day, folks do not have to miss work. And so it makes it a lot more accessible to them when they don't have to take that point or they don't have to take that day off work. Same thing on the student side. The clinic, the school-based clinic is right there on campus. The teachers can go on their lunch break. They can go on their free period. No one has to miss work or miss school.
And how have you built partnerships with other community stakeholders like local government? You mentioned schools, nonprofits to strengthen public health.
I think for us, we're always going to say yes. And so my crew will sometimes roll their eyes and be like, oh my gosh. But I think in a rural community, you have to have that partnership. You have to have that one organization that you can count on. And for us, to me, I want us to be that. I want us to be that very first phone call that somebody makes when they need something, when they need to coordinate something or they need to get a hold of somebody. And so while sometimes that can be absolutely tiring, I think it's also absolutely rewarding. And then it really strengthens the relationship that you have.
And what can other rural or resource limited clinics learn from your experience?
I would say just get out there. A lot of times we feel like Monday through Friday, 8 to 5, I'm doing all that I can do. I think once you start to peel that onion and you start to look at things like social determinants of health, you start to understand, for us, it was an eye opener. We had a patient who we were just having a horrific issue with an A1C. Well, come to find out they didn't have a refrigerator. So guess what? Their A1C was not their primary concern. We've had patients without running water. Okay, if they don't have running water, they really don't care whether or not they picked up their blood pressure medicine. And so again, I think you always have to meet that patient where they're at. And for us, our big motto is, quality team-based care has to be performed at the right time, at the right moment. And it's that moment that belongs to the patient. It's not your moment. It's not Monday through Friday, 8 to 5. It's not, we have an appointment in 2 weeks. It's when that patient needs you. And so the same thing that we want to do as far as being available for our community when they need us at the time they need us, we want to do the same thing for our patient. And so we were looking at things yesterday and identified that we're open access. And so 71% of our patients walk in the same day. And we like that. It keeps it exciting.
So before we close, if you could send one message to healthcare leaders, stakeholders watching, what would it be?
I think that for us, we're primary care and we're rural primary care. And so my biggest push would be, I think we've got to really start looking at some of these reimbursement policies, and they need to match what's actually going on. You know, once COVID hit, and I hate to keep saying COVID, but a lot of things got pushed back onto primary care, things that we never would have done, but now we are doing them and excelling at them, and that patient is used to coming in here and getting that done. And so I think we have to really start looking at primary care and understanding what that whole gatekeeper mentality looks like, because a lot of times we are the first stop for the patient. Even when they go to the specialty, they're coming right back in going, I don't understand. What do I need to do next? And so I think we're going to have to start looking at some reimbursement policies that match the performance of work you're doing. And also the medical complexity of work that you're doing.
Well, Angie, thank you so much for sharing some valuable information about practice management, meeting the community where they are. Thank you for talking about the success of what your practices are doing. Thanks for being here too.
Thank you.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.